So there's quite a vast amount of treatment options that we have available for IBD, and it will all depend on where you are in your IBD journey as to what treatment options you're on. We could spend ages talking about the different type of treatments, but they vary from oral preparations to rectal preparations, some being IV, some being injections under the skin. So it all depends really whereabouts you are in your IBD journey. We have got new treatments currently coming to market, and even since I started working in paediatrics, we've had quite a few new drugs come to market. The hard thing with drugs, specifically in paediatric patients, is it's quite hard to get the safety profile surrounding them, and we need to make sure that things are safe before we can give them to any patients. So normally what happens is with these drugs is they get trialled in adult patients first of all. When they're seen to be safe, then they get rolled out in paediatric patients. So the children that I see, we're starting to see them use some of the drugs that would have originally just been used for adults, and we're having quite good success. If you're newly diagnosed, you should hopefully have a specialised team that's around you, whether that be your local hospital or be your specialist hospital that you're working with. Ask as many questions as possible, do your own research, but do research from evidence-based websites like CICRA, like NHS.net, and try get as much information as you can. Clinic appointments are so short and there's not much we can do about that, but if you're going in asking the right questions, you'll come out a lot more empowered and you'll have a lot more information when you leave. When I first see them, a lot of the questions are about the actual medicines that they're going to be taking. A lot of them maybe have never taken a tablet before, they've never taken a liquid medicine before. They're asking, is it going to taste funny? Will I be able to swallow a tablet? So a lot of what I do is working around those concerns. Obviously from the parents' point of view, we get a lot of questions about side effects, but before we ever start any treatment, we should have gone through all of that information with you or with the patient. So the main thing I get asked about currently is switching patients from liquid to tablets. As the children grow and the parents feel that they're capable of swallowing a tablet, we try to get them onto tablets as soon as possible. It makes things a lot easier for the patient, it makes things a lot easier for the parents, it makes things easier for travel, sorting it around hobbies and different things like that. We get this question quite a lot. Sometimes it can be that patients are struggling to take a tablet, sometimes it can be that patients are struggling to use a rectal preparation. With rectal preparations, obviously these can be quite embarrassing for patients to talk about sometimes, but it's absolutely normal. It's our bread and butter, it's what we do every day. So if you're struggling, please pick up the phone and ring your specialist nurse or ring your pharmacist if your team has one and suggest to them, I can't use this rectal preparation, it doesn't agree with me, or I'm not able to retain it. It may be a case that there's another rectal preparation that we could use or we could try that suits you better. With regard to tablet swallowing, so we've quite a few patients who are on liquid medicine. Now the liquid medicine doesn't taste very nice to begin with, but with tablet swallowing a lot of people have a bit of a taboo or a fear about taking tablets. It's quite easy, and we actually run a course within GNCH about teaching children how to take tablets. It can be done in hospital or it can be done at home, and we have all the literature to send home, so by all means just ask and we can help you. Currently at the moment with the treatment options, we very much have a ladder approach. So we have step 1, if that doesn't work, we go to step 2, if that doesn't work, we go to step 3. Hopefully in the future, what we could have is a few different options for step 1, and we could pick something that works best for the patient at that time. Our hands are quite tied at the moment and we're doing the best we can to try open up the field a bit.